Total 3 pages, okay?
Okay, ma'am.
Started your time.
Got it, ma'am. Next page, ma'am.
Sorry.
Next page, ma'am. Ma'am, this is the last page, right, ma'am?
Yes.
Got it. Okay, ma'am. Ma'am, this includes 2 minutes time, ma'am, or
Yeah. Last 15 seconds.
okay, ma'am.
Started your 10 minutes time.
Okay, ma'am. Hello, I'm Dr. Shweta, one of the doctors in the accident and emergency today. May I confirm your name and age, please?
Yeah, doctor. I'm Aisha and I'm 28-year-old.
Okay, may I call you Aisha?
Oh, yeah?
Okay, Aisha, I gathered from the GP letter that you've had a delivery 10 days ago and you're now experiencing excessive bleeding down there and some pain. Is that right?
Yeah, doctor.
Okay. So Aisha, since it's my first time meeting you, I would like to ask you some questions quickly so that I get to know better about you. And then together we'll explore our options on how to go about your management. Would that be fine?
Oh, that's really great, doctor. Thank you.
Okay. Aisha, what are your... so Aisha, sorry, can you tell me more about what happened?
Uh, yes, doctor. I delivered 10 days back.
Mm-hmm.
Um, and I went home after 12 hours because there weren't any bed. The
Mm-hmm.
delivery was induced one. I was in labor for a long time, but I
Mm-hmm.
delivered. Placenta took a little bit time to come out.
Mm-hmm. Mm-hmm.
I was absolutely fine. Went home. 2 days back, I
Mm-hmm.
noticed that there is some tummy pain and then some spotting.
Mm-hmm.
And since morning, I'm having very uh, bad tummy pain, and even I am having bleeding.
Mm-hmm. I'm so sorry to know that, Aisha. How are you coping up with the pain?
Uh, no, I had been given some pain relief, and the GP referred me urgently here.
Okay, okay, Aisha. Aisha, so can you tell me, you said you delivered 10 days ago. So was it by a normal vaginal delivery or you had a C-section?
It was vaginal delivery. I was induced
Okay.
because I was
Mm-hmm.
post dated.
Mm-hmm. Mm-hmm. Okay. And do you remember if the labor was long, if you were in pain for a
Yeah,
long
yeah, I
time?
told you. I told you the labor was pretty
Okay.
long.
Okay. And were there any problems when with the delivery of the afterbirths, or did you bleed excessively after you delivered the afterbirths?
No, I didn't bleed, but yeah, delivery of afterbirth took some time. The midwife who was there, she need to remove it by introducing hand and something like that. So she had
All
to
right.
pull that out in the labor ward only. But yeah, it was
Okay.
taking some time.
Okay, okay. Aisha, with your permission, I would like to review your notes. Would that be okay?
Yeah.
Okay. So Aisha, can you tell me if you have developed any fever or any, do you feel sick in the tummy, like nausea,
Yeah, yeah.
vomiting,
I do have this fever since morning. I have noticed.
fever? Is it okay? And do you feel giddy?
No,
Okay. Did you notice any kind of tissues being passed from down there, or do you feel that there is any foul smelling discharge from down there?
no tissues, only foul, no foul smelling, but it's a fresh blood red. Red.
Okay, it's fresh blood. Okay, okay. So Aisha, can you tell me, have you been pregnant before?
Yeah, I'm having a 4-year-old son, doctor.
And any concerns during that pregnancy or during that
No,
delivery?
nothing, nothing.
Okay, okay. Aisha, can you tell me about this current pregnancy? Did you have any concerns in this pregnancy? Any high blood pressures or
Oh,
sugars or
it
any
was
admissions?
absolutely no, it was absolutely normal pregnancy, nothing to worry about.
Okay, 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 Aisha. So Aisha, some personal questions. May I proceed?
Yes,
Yeah. So have you resumed having sexual intercourse?
no,
Okay. Aisha, any history of you or your partner being ever treated for any sexually shared infections?
no,
Okay. Have you been regular with the smear testing?
yeah,
Okay. So do you see your GP regularly for any of the concerns, like high blood
no,
pressure, sugars, or clots? Or
no,
okay. Are you on any medications that you take regularly?
no,
All right. Any surgery on your tummy or down below?
no.
Okay. Are you aware of your blood group?
I think it's positive.
Positive. All right. So any reservation for blood transfusion?
No,
All right. Any concerning history in your family, like high blood pressures or sugars or clots?
no,
Okay. Aisha, are you aware of your weight height ratio?
it's normal.
Okay. So do you smoke, drink alcohol, or pardon me, any recreational drugs?
I used to smoke and drink some pegs of alcohol, but once I got to know that I'm pregnant, I stopped
Okay.
it.
Okay. Okay. That's good to know. So Aisha, what do you do for a living?
At present, I'm at home. I'm not working.
Mhm. And are you well supported at home? Who do you live with?
Yes, I stay with my husband and I'm very well
Okay.
supported.
That's good to know, Aisha. So Aisha, can you tell me if you've been feeling low, depressed, or over the edge in the last few days?
No,
Okay. So thank you so much, Aisha, for all the information. Is there anything else you would like to tell me?
I'm just worried that whatever it should be, I'm very keen on breastfeeding, doctor. Okay,
All right. Okay.
so
Okay.
it should not hamper my ability to feed my baby.
That's a very valid concern, Aisha. Aisha, next I'll be quickly examining you in presence of a chaperone. I would like to see if you're running fever at the moment, and I'd like to know the heart rate, blood pressure, and your breath sounds, and the respiratory rate. And then I'll be briefly examining your abdomen and from down there. Is that okay?
Okay.
Okay. And if there is any abnormal vaginal discharge, I would like to take a swab as well for the testing. All right. So, Aisha, have you been briefed about your condition? Like, are you aware what's happening?
No, doctor, I'm just worried.
All
Means,
right.
is there anything to worry about?
Okay. So, Aisha, see, some women, unfortunately, after the birth of the baby, and most of the times it's usually within the first 24 hours, they develop excessive bleeding after the afterbirths. All right. And at
Mhm.
times, what can happen is this excessive bleeding can come anytime after 24 hours and within 6 weeks, while the uterus is still trying to shrink back to the original shape and size. Are you with me?
Okay. Yeah.
Okay. So that's called something called as a secondary PPH. All right. Now, let me draw a picture for you. Now, this is the womb and this is the inner part of the lining of the womb. And at times, there can be some amount of the afterbirths which get retained somehow within the womb. Are you with me?
Okay.
Okay, and this bits of tissues can sometimes cause women to have excessive bleeding.
Okay.
Okay, okay,
Okay.
and at times what can happen is this lining could have been infected, like develop some bugs and develop some infection, and that's the reason probably you could be bleeding. Okay.
Okay.
And the other reasons could may not be related to the pregnancy, but very rarely there can be some sinister changes in the neck of the womb. But since you have been regular with your smear testing, I don't think there is a cause to worry. All right. So to look into what exactly is happening, I would like to run some blood tests. Are you
Hmm.
with me, Aisha?
Hmm.
And also, I would like to suggest you to going for a ultrasound scanning to look at the insides of the womb if there is any collection or if there is any tissues that are there inside of the womb. And your care definitely will be alongside by the specialized team of doctors who would be caring for you. Okay,
Hmm.
including my consultant microbiologist and the scan doctor. Okay, and the sleep doctor as well. Are you
Hmm.
with me, Aisha? And
Yeah.
depending upon the reason, you will be treated. Right now, when the bleeding, if the bleeding happens to be excessive, then you will be given a shot of antibiotics, okay, to avoid or control the infection. And
Hmm.
if there is any retained bit of tissues we have noted, then you may also need a procedure to remove them under the anesthesia, which would be by the sleep doctor. Okay,
Hmm.
and this procedure will be done by my senior consultant. Are you with me?
Okay. Is it safe to undergo this procedure, doctor?
Yeah, I sure like if there are retained bits, if we do not remove them at times, what can happen is the infections can spread to the womb and the the tissues around it, which can make a big threat to your life itself. So it's very necessary. It's of utmost importance that we remove this tissue so that we can control the spread of infection. Okay, and at times when we give the anesthesia medicines, the medicines used for anesthetic drugs may get secreted into the breast milk. All right, but we can just wait for a couple of hours for the medicines to be washed out in the breast milk, and then you can definitely safely breastfeed your baby. Are
Okay.
you with me, Aisha?
Yeah, yeah, doctor.
Okay.
Yeah.
So you depending upon the cause, you'll be managed, Aisha. So should you have any concerns, it will definitely be addressed, and should you have any preferences, also it will be addressed. Okay, but generally, once we have identified the cause, we go ahead to treat that, and we respect that, and we support the breastfeeding definitely, and breastfeeding will be encouraged, and you will be assessed if you're able to care for yourself and for the baby, and we would be assessing you if you're coping up with the situation, and if need be we can put you in touch with a counselor to help you cope up with the situation as well. Are you with me, Aisha?
Yeah, doctor. Thank you.
Okay.
Okay.
Hello, ma'am,
Yeah.
time's up.
Yeah.
Sorry. Okay, okay, ma'am. Okay, sorry, thank you, ma'am.
You end the session, doc, dear. End
As-
it properly.
Okay, so Aisha, I would also be you would also be given painkillers, and you'll be given antibiotics to control the infection, and I'll be putting you in touch with the contraception clinic who can advise you regarding using effective birth control measures to prevent unwanted unplanned pregnancies, and you will be also put in touch with a preconceptional clinic. And in the next pregnancy, we would advise you to book into the consultant unit, and you will be screened if there is any anemia, and you will be treated if there is any anemia. Okay. At the moment, I'll be putting you in touch with my consultant right away, and we'll be evaluating you, and we'll be writing back to the GP about our findings and discussion. Would that be okay, Aisha?
Oh, yeah, that's great, doctor.
Okay.
So, do
Anything
I need
else?
to get admitted, doctor?
Yes, Aisha, yes. Yes, please. Because you're having bleeding at the moment, you will be admitted now and evaluated. All right. And once you've been treated, you'll be kept under observation depending upon how you recover, and then you will be discharged home, Aisha.
Thank you, doctor.
Yeah. Is there any other concerns, Aisha?
No,
Okay. Thank you so much, Aisha.
total 12 minutes.
Yep.
Time management.
Got it, ma'am.
Okay. Good points about your own preparation, own task, and then the points where you need to improve from your side. Then we will ask the audience and then the feedback.
Okay, ma'am.
What do you think about your good points?
Mm. Ma'am, history, I did miss many things in the history. Um, I should have been a little more organized in my thoughts. Mm, I asked my patient if she was with me. Hello, ma'am.
I'm listening.
Yes, ma'am. Um, yeah, ma'am.
Okay. Uh, okay. Let's ask the audience. What do audience please comment on her performance?
She was very nice, ma'am. But in asking the history, she should have inquired about fever. I think on
She
examination, she said,
inquired.
"I."
She inquired about fever.
Okay, okay.
She has asked nausea, vomiting. She has asked fever history. She missed out on bladder bowel symptoms. She asked about foul smelling vaginal discharge. Okay. Bladder, bowel, baby, and breastfeeding. She missed out on all those 4 points.
Baby breastfeeding.
Yeah. Otherwise, she was very nice in applied knowledge.
Yes. And then, yes, yes, who
But
wanted to?
breastfeeding, she asked, ma'am. I didn't, I mean, listen that part. Breastfeeding,
No, she didn't ask breastfeeding. She
breast,
missed out on bowel, bladder, baby, breastfeeding.
breast, yeah, yes, ma'am, baby breastfeeding. And
Okay.
she told some medicines washed out.
It is basically she wanted to tell that if you are undergoing the procedure under general anesthesia, then the uh,
Is it,
breastfeeding,
is
yeah.
it like that, ma'am?
No, no, no. It is not like that. Okay. So whatever procedure we are going
Oh,
to do, it will be safe. You just need to tell that. Most of the time,
okay.
if at all it is done, it will be done under anesthesia, local or spinal anesthesia, regional anesthesia. Just need to reassure her that whatever we are going to do, it will be safe for you and your baby. That is one thing.
Okay.
The
Okay,
risk
ma'am.
and pros and cons of the treatment you didn't explain, dear. One more point
Yes,
when it
ma'am.
comes to history taking, you took almost 6 minutes time for information gathering, which is not. I'm telling you your negatives. There are many
Got it,
positive
ma'am.
about, yeah, there are very many positive about your performance. Communication is your strength. Okay, you are having a very good nag on your communication, very good hold on your communication. Sorry. Um, you communicated, you checked my knowledge, you were involving me, so those are your plus points, Dr. Shweta. The points which you need to improve is because you were asking and combining 2 3 questions at a time. Not
Mm-hmm.
only once you did this, you did it 3 or 4 times. Okay. Nausea,
Mm-hmm.
vomiting, fever, bleeding after the delivery. How was it? Whether you bleed, whether was it whether the placenta removed was removed after birth removed normally. Okay. So these 2 3 questions, and lastly, when you asked me another time, smoking, drugs, and alcohol. Okay. So you were not only once or twice doing that, you were doing it repeatedly, dear.
Mm-hmm. Yes, ma'am.
Okay, so then you should not do this.
Okay, ma'am.
Okay, so see to it. Only relevant history we need to ask. We do not need to go into detail of the history. Mm.
Okay, ma'am. Okay, ma'am.
Medical history, surgical history. Do you think surgical history makes any significance here? Means
If she has had ma'am, I was thinking, if she has had a previous surgery and if there was like any problem, any transfusion, if she has received, like that was there on my mind. Like if she says she has had any transfusions before, then probably red cell antibodies we need to ask. So I asked for the surgery.
please. See, this is MRCOG. This is very simple exam. Don't get complicated. The last sentence when you said you need to book yourself under consultant-led care unit in the next pregnancy is not needed, dear. Here, it's an absolute low risk pregnancy. This is a complication of a normal pregnancy. So that doesn't mean that she needs to be booked under consultant-led care unit. She needs to go for preconceptional care. We are complicating it. We are complicating it. Do not need
Okay,
all
ma'am.
those complication. Okay. So no
Okay,
need.
ma'am.
So this piece of information you had missed out very nicely. You had asked about STI, sexual history, smear. Medical history is good. Okay, you didn't ask me my concerns, my expectations any of the time. Okay, you asked it by the end of the task, not in the beginning. By that time, you might not be having time to ask those questions. And the next questions, what you didn't ask, you explained me very nicely that this is called a secondary PPH. You need to check my knowledge whether I have heard about this condition previously. This is a
Okay.
basic rule of RCOG. Whatever you are explaining to the patient, whatever diagnosis you are telling to the patient, you please check their knowledge. Whether you have heard about this condition. A simple question. You will be ticked mark on two domain, information gathering and communication with patient. Okay.
Okay, ma'am. Okay,
So
ma'am.
please ensure that you will check their background knowledge. What is their starting point? Yes. Reassure, treatable. Yes. You didn't admit me.
Yeah. Yes, ma'am.
This is compromising your patient safety.
Patient safety.
Uh, okay, you
Yes,
offered me
ma'am.
examination, so that is information gathering. You offered me investigations. What investigation you did you offered me, dear? Can you just repeat it?
I didn't elaborate, ma'am. I said you will be, we'll do the blood testing to look at the infections and the blood level and the ultrasound, ma'am. Ultrasound to look at the womb. I said I should have elaborated on that.
No, not needed to elaborate. Swaps. Okay, vaginal swab because
Swabs.
infection is an
Uh,
yeah, when infection is when swab and even urine routine microscopy. I have also not included that urine routine in my answer key, but those are the common investigations what we are going to do. Okay,
Swabs.
so
Yes, ma'am.
yes, so those investigation, if nothing comes out, then we will just wait and watch and observe you. That is one thing.
Mm.
But if
Mm.
there is some tissues, some infection, hmm,
Yes,
then
ma'am.
there will be symptomatic treatment like antibiotics, antipyretics, anti-nausea medication or anti-sickness medication. Along with that, depending upon the tissues, if there are any retained tissues, depending upon the tissues, we will be discussing the further options whether to we can wait and watch, give medications, or go ahead with the surgery. Pros and cons of each option. Hmm? Wait
Okay,
and
ma'am.
watch.
Okay, ma'am.
Many times, these tissues gets expelled on its own. Sometimes there is a chance of infection building up. So we may need some medications like misoprostol to push
Mm.
these tissues outside the uterus. Lesser intervention, but yes, the chances of completion of the procedure will not be there. To complete the procedure, if there are a big chunk, okay, big chunk, and it is not possible and you are bleeding, then in that case we may have to take a decision to go ahead with the surgical evacuation. So this will be
Mm.
done under anesthesia. You will be consented for the procedure. The senior person or the person who is expert in trained in this procedure will be doing it. Hmm? Okay. Many a times we will be doing it under anesthesia and under ultrasonographic guidance. So pros and cons of this procedure, if I wanted to listen. Okay, so safe
Okay, ma'am.
when it comes to breastfeeding and for yourself because the experts are doing, but then there is a chances of bleeding, there is a chances of tear in womb. So we need to be aware about that, and that's the reason we can minimize by using a expert you by performing a visit
Ultrasound.
of expert and under ultrasonographic guidance. Okay,
Mm.
and a
Okay, ma'am.
very rare possibility, what are the other rare possibility of this scenario? Differential diagnosis.
GTN.
Yes, very correct. Very rarely we may encounter, and this tissue will be sent for histopathology, and then
Histopath.
yes,
Correct.
then we will be discussing the further care. Sometimes there might be a small possibility of having abnormal placental condition known as GTN or molar pregnancy. For that, we will be checking her beta-HCG, baseline beta-HCG. Okay, you are just going to do this
Okay.
now. You are going to offer her admission. You are going to ensure her regarding her breastfeeding, means because she's concerned about breastfeeding. Nothing will hamper her ability to breastfeed. You are going to write down
Mm.
formulate a plan where you will be informing your consultant and informing the GP and patient information leaflet if it is available regarding the secondary PPH or something like that. Okay. So that's
Okay,
it.
ma'am.
Yeah. So you need
Okay,
to
ma'am.
check the background knowledge. You need to give them more options. So what will be your options now? After admission, wait and watch, medical or
Mm.
surgical. Not only one line. Okay. And then pros and cons
Okay.
and what you will be doing to minimize those complications. Okay. So this is there.
Okay,
Yeah,
ma'am.
very good presentation. I'm happy. You need to manage your time. Do not combine two or three questions at a time. Okay.
Okay,
Anything
okay, ma'am.
else? IV antibiotics and IV antibiotics you mentioned. Mm, few points you mentioned after 2 minutes, 10 minutes time, but I have taken it as a positive thing. Okay. Mm, no need to involve in simple tasks, no need to inform the counselor. Do you think the patient good? You had
Okay.
asked me about my mental history because it's as a new mom, some complications I might be having. But if I'm not having, then do not involve any counselor unnecessarily.
Okay,
Okay.
ma'am.
Yeah, max to max, you can
Okay.
just offer me a support group where I can chit chat with the similar person who had a similar experience in the past. Okay, support group, actually
Okay,
there
ma'am.
is no particular support group for PPH, but you can just birth trauma association is a support group where there are multiple problems and multiple people who are there. Okay, it is a
Okay, ma'am.
wide entity. Okay, so you can just say any
Yeah.
traumatic experience associated with delivery, you can just label that support group. I will encourage you people to use a specific support group and specific patient information leaflet. Okay, so introduction, confirming aim of the very nicely. You are having a very good situational awareness because you are seeing me in the emergency, but you didn't. So now I just wanted to tell all of you who are attending this class, if in the patient, if you are seeing this patient in the emergency, you will always have two options: whether I can send this patient home or whether I need to admit this patient. That is patient safety. Okay, so admission of this patient is patient safety. Always remember, whenever you will be given a scenario where you are seeing a patient in the emergency, just assess whether this patient needs admission or whether this patient needs uh, to
He
send
can be
home,
sent home.
safely
Come back.
send home
Okay.
this patient. Okay, that is patient safety. Why I'm bleeding? That is my first question, concern. My evolving concern is whatever treatment you are going to offer, is it safe for my baby? Explore concerns, details of bleeding, foul smearing, bowel, bladder, fever, nausea, pain. Details, delivery accessed. You accessed my delivery care. Okay. Past delivery, any history of PPH, placenta removal. In the detailed history, you need to, if I had not given you history of second stage or third stage of labor, if I am not giving you third stage of labor details, please ask the detailed third stage of history. Okay. Third stage of labor history. Previous obstetric history, any similar episode in the past. If breastfeeding, acknowledge that I am very, means I can see that you are breastfeeding your baby. In US, UK, not many opted for breastfeeding. So you need to acknowledge, yeah, I am really happy that you are breastfeeding your baby. I will assure you that whatever you treatment we will be choosing, it will be safe for you and your baby since you are breastfeeding. Okay. Risk factor, medical allergy, support at home and smear. These are my other questions. I had not asked any surgical history because I don't think any surgical history is important in this scenario. Okay. If you anybody can come up with any surgical history, I will be happy. But as of now, my mind is not thinking of any surgical history which is relevant to this topic. Okay. Mental history is very important. Any postnatal period patient presented to you day 7. It's very important. Resume sexual intercourse. You asked me. You offered me examination very nicely. At the same time, you can like, offer me investigations also. So now I will be taking swab from the internal organs to see whether there is any infection building up. Explain secondary PPH in medical term. Did you know how heard about something like that? Very nicely, you had used a drawing and you had explained me. Checking background knowledge is very important. Bleeding from 24 hours after up to 6 weeks of childbirth is secondary PPH. Many reasons, we do not need to say only one reason. Yes, and very nicely you mentioned that a rare possibility of having some abnormal changes in the neck of the womb also, so that might be a possibility. So infection, I had mentioned here, subinvolution, membranes or placental beeps. Sometimes it is an infection which is building up inside the body of the womb, subinvolution, membranes or placental beads. So these are the reason why we are having bleeding post delivery after 24 hours. uh, Curable. Okay, so it's a treatable, but we need to admit you to know what is the exact cause, and we would like to offer you certain investigations. So full blood count, you hear swab, urine pregnancy test or beta hcg to see baseline beta hcg, ultrasonography and urine routine microscopy. Okay, why I am need to see the USG? So to see whether there are any tissues place present. admission under consultant-led care units. Whatever antibiotics or whatever painkillers we will be offering you will be baby friendly and safe with breastfeeding. Observation further, and meanwhile planning a management of any retained product of conceptions or any placental bits or tissues are there. So if at all, means here I am giving you two prongs or two side of the management. One side is where if nothing comes up, you had no further episode of bleeding and nothing comes up in all these investigations, then we can send you home safely. Okay, but if there will be repeatedly bleeding, there will be some bits of placental tissue, some infection building up inside the tummy, in that case we will need to go ahead with the treatment modality. So what are the treatment modality? Either to wait and watch, medical line of management, or surgical line of management. If we decided to go ahead with the wait and watch or medical line of management, yes, we will avoid the risk associated with surgery and anesthesia, but the completion of the procedure we will not be 100% sure. So to have 100% security that we are going to remove all the products completely, surgery is the best choice. So if it is surgery, then consent, the anesthesia review, okay, is very important. um Advantage, disadvantage I had mentioned. Okay, consent, alternatives, wait and watch, medications like misoprostol. Advantage, avoid surgery but chances of failure and further bleeding, so surgical evacuation is then definitive option. Advantage of surgical evacuation is complete cure from bleeding. Disadvantage, tear in womb or perforation, you can use that word also. Bleeding, may need surgery if there will be a perforation occurs inside the womb, because it's a blind procedure, and the whatever tissues we will be getting, we will be sending it for the tissue testing. Occasionally, we just need to tell them that we might encounter with abnormal pregnancy conditions like molar pregnancy, which will be detected on histopathology or tissue testing. If at all this will be happening, then we will be discussing your care post histopathological evaluation. Okay, now again you just need to ask her whether she wants to discuss anything else. Explore concerns. Here my concern is, I just wanted to ensure that it will not affect breastfeeding. So you have, again, you can reassure her no treatment will affect her ability to breastfeed her baby. It will be safe during breastfeeding. Okay, and once recovered, she can be her care will be shared with the GP surgery, and we will discuss the contraception. PIL of heavy bleeding after birth, we can offer her, and we can connect with the people who had a similar experience or similar situation. So birth trauma association, she might find similar stories or similar situations where she can connect with those people. Okay, so here you can end the task. Information gathering is details of the pregnancy and delivery you had elicited, symptoms of bleeding, pain, possibility of pyrexia you asked, establish exclusive breastfeeding, you didn't acknowledge this information, history of previous pregnancy you had asked, temperature, pulse rate, respiratory rate, you had asked me that information, reviewing of the case notes for additional information, you had asked that, initiate investigations you had asked. So clear pass in information gathering domain, communication with patient and families, explain possible causes of retained products of conception such as membrane or with or without infection, may need admission into hospital, antibiotics, evacuation of products, antipyretics and analgesics, explain complication of surgery. So here I will be giving you borderline, okay, because you had missed out on few points which are important points here. Communication with colleague, you need to involve the senior, you need to go back, right back to the GP surgery here. If it is infection, microbiologist or histopathologist depending upon the situation, and ultrasonography. So you had mentioned, so here I will still give you a clear pass. Patient safety, okay, patient safety I will give you borderline. You confirm my patient details, empower me to take an informed choice. Admission was not offered to me. Treatment of PPH, pros and cons of all the options you need to tell me. Most common cause to rule out, most common causes, but we need to rule out molar pregnancy by doing beta hCG. Okay, that is a rare possibility, but yes, we need to rule out that. Safety of treatment with respect to breastfeeding, you had mentioned that. Inhibition of drug, inhibition and effect of drug on the baby, you discussed. Contraception, established drug allergy, it was not, and safe prescription in lactating mother. Okay, this is secondary PPH causes of secondary PPH, treatment options associated with secondary PPH, knowledge according to that. So here also I will give you clear pass. So the domains which we need to improve here are patient safety and communication with patient and family. That also you must have realized now why it is needed. Okay. Any question anybody is having? No?
Ma'am, now when we are telling the patient about the investigations that we want to do, how do I articulate, ma'am? Like we'll be doing the complete blood count baseline. How do I
Yes, yes.
articulate, ma'am?
Yeah. So the sentence that there, okay, so this is a secondary PPH, that diagnosis is confirmed. We need to manage you for further care. We need to see whether there is any infection building up and what is your hemoglobin strength. So we will be sending the hemoglobin, your full blood count, your urine to see whether there is any infection on the private inside the vagina, or in the blood we will be seeing by, or in the urine, then we will be sending urine routine and swabs from vagina to see whether there are any abnormal tissues inside the placenta, some bits of placental tissues inside the womb. To check that, we need to do a vaginal scan or a abdominal scan. Okay.
Okay, ma'am. Okay,
Simple
ma'am.
sentence. Simple sentence. Okay. Just one sentence of each means we just need to see whether you are healthy and not having any infection building up, not abnormal tissues inside the womb. So these are the investigations what I'm going to send. So investigation, sending investigation is also comes up under information gathering. Okay. Anybody, any question? Shall we end this topic here? No question. Clear? Thank you.